Hi everyone, welcome back. We hope you had a restful and pleasant lunch. We are delighted to continue the training with the Elder Justice training for 2021, and it is my great pleasure now to introduce to you our next speaker, Dr. Ann Fruhling. She will be presenting on telemedicine, digital challenges and opportunities for older adults. Dr. Fruhling is a biomedical informatics professor in the School of Interdisciplinary Informatics in the College of Information Science and Technology at the University of Nebraska, Omaha. Dr. Fruhling serves as a co-director of the Nebraska University Center for Biomedical Informatics Research and Innovation and as the UNO director of the Public Health Informatics Research Laboratory. Dr. Fruhling's research focuses on health informatics and evaluating and improving human-computer interaction efficiency and effectiveness in the healthcare and public health domains. She has over 120 publications and has been a PI or co-PI on research projects totaling over $8.5 million. Currently, Dr. Fruhling is the principal investigator on a UNO-UNMC collaborative grant sponsored by the Department of Transportation. It is my great pleasure to introduce you to my colleague, Dr. Ann Fruhling.
Well, good afternoon, everyone, and thank you, Antonio and Julie, for inviting me to be at this presentation and to meet all of you. And thank you all for attending and for all the important work that you do. I wanted to share a short story on why this is so important to me. And before I begin, one fun fact is that I am a native of Nebraska, and I grew up in Kearney, and I actually went to country school, my kindergarten and first grade years. And I have a background of family that's a farming community. And my father, who lived in Colorado for over 40 years, decided to relocate back to Axtell, which is about 15 miles south of Kearney. And he was living independently in an apartment complex. And he was at a point in his life that he decided that he should not be driving anymore. But all of his friends would meet uptown for coffee every morning at 10 o'clock. And so he wanted to be able to go up there and see them, and he would have to walk, and it was about 5 or 6 blocks, and it was kind of getting hot, and so on, and he didn't have a car. So he convinced me that he needed an adult tricycle. And he worked on, we talked about this, like every phone call, every day was like, when can I get this tricycle? And so finally I gave in, and I helped him purchase a tricycle, and he got it. And the first day that he rode this tricycle that he was going to take uptown, he actually had a tumble, and he went off the side of the road and fell over in a ditch. And he laid there, and he hurt his shoulder. And anyway, he made it home, and we talked a little bit, how was the tricycle, and he told me he had hurt himself. And so I was a little bit concerned, but not overly concerned. I thought it was a little more funny than anything. But it was also the same weekend as my birthday. And of course, because I helped him get this tricycle, he sent me flowers. And so when I got the flowers, I tried to call him to tell him, thank you so much for the flowers. Well, as I was trying to get a hold of him to tell him thank you, he wouldn't answer the phone. And this went on several times throughout the same day, and I thought, this is very strange that he's not answering a phone, especially since he just sent me flowers and probably would be expecting a phone call. So I let it go for that one day, but the next day he still didn't answer the phone, and then I became worried. And because I didn't know any of his other apartment dwellers, I didn't know how to get a hold of him. And so I decided to call the local hospitals to see if perhaps he had called 911 and went to the hospital, because that's really the only care that he had. And no, he wasn't at a hospital. And so they suggested that I call the county sheriff to do a well check. And sure enough, the county sheriff went there, and he found him on the floor, and it had been almost over 2 days. And he could not reach the phone. He had sat down in a chair, but he couldn't get back up because he had cracked a rib, which I didn't know. And then he ended up puncturing a lung. And so fortunately he survived, and everything was well today. But it does bring home the importance of all the work that we're doing in this area of helping what telemedicine can do, how we can help people age in place and help them to be safe, and also help the caregivers. So those are some of the important reasons why I'm here today to share with you some of the things that I've learned as well. So the goals of the presentation are, first is to provide an overview of telemedicine, to also talk about a lot of the different relevant terminology in health IT and assistive technology, because there's a lot of new things happening. Things are moving very fast, especially with technology. I'd like to share with you how to better understand the preferences of aging adults and what their preferences are as far as remaining in place. Look at what the different assistive technologies there are today. What are the challenges of using those technologies and adopting them? And then finally look to the future on what smart technologies might also help us as we go forward. So the first thing that I would like to highlight is telehealth. And you hear this a lot, and you'll hear telemedicine, you might hear teleconsultation. So telehealth is the use of electronic information and telecommunication technologies to support long-distance clinical health care, patient and professional health-related education, and public health and health administration. Telehealth serves a lot of different purposes. When you look at telemedicine, you're looking at it more focusing on the provider and what the provider and the patient's relationship is. And so that would be the medical side of delivering health care. Telemedicine is a subset of telehealth. Teleconsultation is a dialogue between the provider and a patient, or a provider and another provider. So for example, I know of a provider in Norfolk, Nebraska, and when he has a difficult case on neonatal care, he will consult with a physician at the Nebraska Medical Center and get his expert advice or her expert advice. But the point is that it's teleconsultation. So from a legal perspective, they can consult, but they cannot diagnose. So the diagnosis will be determined by the provider who is providing the care of the individual. And then another term that is somewhat related to these is e-health. And e-health is the integration of technology with medicine and healthcare. And that's the area more of industry and business, and you'll see a lot of different applications in this area. This next term I know is very common to you, but I just want to make sure we're all on the same page, is aging in place, the practice of aging in one's community and often in one's home. And for just understanding how important that is, that aging in place, and to be independent and have independent living where a person has their individual autonomy without compromising their health and their safety. Now, this field of supporting aging adults has become very interdisciplinary, and that's one of the areas that UNO is really moving a direction in, is combining technology with gerontology. And so I'm working with a lot of different researchers in gerontology, specifically looking at where technology focuses on the needs of aging adults, or gerontology. How do we help folks with these needs, the aging adults, is looking at what different assistive technologies are available today and looking if they're actually meeting the needs of those particular individuals. One of the most growing areas of assistive technologies is what we call wearable technology. And most of you probably have a Fitbit or some kind of, or a smartwatch or something that you're wearing that's a wearable technology. And that these help you or track different biometric data, or like heart rate, blood pressure, perspiration, how many steps you walk. So this wearable technology can be very beneficial on monitoring the health of a person and how they're doing. How is this done is through sensors. So a wearable technology device can have many sensors on it. And these sensors are what they're used to measure the blood pressure. You can even, again, you can do ECG, you can do the heart rate, you can do some things on the environment. This is an area where a lot of my research is that I'm working with the Omaha Fire Department on monitoring the health of first responders. And when they're in an incident, we want to see how their health is, and their blood pressure and their heart rate and all of this is, because when you're in an excitable environment, you don't know if your health is being compromised. And so these sensors can do that, but there are some concerns on the validity, the reliability, the accuracy of these sensors. And so that's something that we all need to be aware of. So these sensors and these devices are all grouped into a common area called smart devices. And the smart devices are everyday objects that can be made intelligent. And they're connected together often through a Wi-Fi or through the internet. And then by that network, they call it an Internet of Things. You might also hear it as IoT. And so this IoT, the Internet of Things, is basically these objects that have these embedded sensors that gives people the ability and software to help them exchange information, to monitor it. So let me give you a couple examples of an IoT. And I think the one that I think is a very recent one that I know is someone that recently got new hearing aids. And they have become a long way that the person, before they got the new set of hearing aids, it was just a basic one that you could hear better in a room. Well, now what it does is the hearing aid is connected to their phone, it's connected to the smart bar on your television. It can be controlled through the phone, and it can be, depending on what the environment is, you can adjust it. And then also for the caregiver or the partner is they can actually wear a lapel pin, and it will pick up their voice, and they can go out to a noisy restaurant, or they can go to a concert or some other event, and they can hear the person sitting next to them that they never were able to do. And so I think that the quality of life on a lot of these new smart devices using the Internet of Things technology has a lot of promise for us. In addition, we have smart devices that help us with our homes. And they can help us with our lighting, with our heating. They can help us with, specifically in security and having the security cameras. And I think that with the presentation with Mr. Greenwood earlier, I think we can really see the value of having a lot of smart devices at our home. And if you were in a position that you're the caretaker of someone that doesn't live nearby you, wouldn't it be nice to be able to go to mom and dad's house and see who's been at the front door, or where is somebody, or you could even just check in visually, or and so on. So I think that there's a lot of promise here, again, of helping people remain in place in their home. The talk that overview of the talk is on telemedicine, and I'm going to focus a lot on assistive technology, but the importance of this is that, sure, we have these telemedicine visits and we use telemedicine, but what do you do between the times when the patient sees the physician or their provider to the next visit? And so a lot of times these assistive devices can help us monitor and know if there's a time that we probably need to see the physician sooner than later. And a lot of this information is stored in what we call an electronic health record. And the electronic health record is a standardized repository, which is a fancy word for database, to maintain all the information about an individual's lifetime health status and their data. It's more of a generic term. They'll call it the electronic health record, the EHR. The EHR is standardized, and the reason I'm focusing on that is that different networks of providers, like if you had Nebraska Medicine, or you have Allegiant, or you have CHI, they may use different software or applications that actually store the electronic health record information for a patient, but they're in different formats. And that is known as the electronic medical record. The electronic medical record is owned and managed by the organization that the patient goes to, or where the provider is established at. Because they're concerned about that the data that is entered into the electronic medical record is valid, it's standardized, and that it's protected. That it's not being shared, it's not being viewed by someone that should not see it, because it is private information. So I'm going to jump back to the electronic health record. It is standardized, and what's important about that is that the electronic medical record can be formatted into an electronic health record that then can be shared across different organizations that have different formats or have a different specific electronic medical record. The other type of record is a personal health record. And this is one that you, as an individual, have your own health information, and you manage it, and you decide who sees it, you control it, And I think it's beyond just the standard of going to the doctor type of medical information. It could be the records of your weight management. It could be with your nutrition. It could be what kind of medications or vitamins or that you're taking. So it's beyond just what you go mainly to see for a physician. Google has a place for that. You can store it. You can store some of it yourself. Even your Fitbit, when you interface that with your own computer, is basically part of your personal health record. So just to revisit the difference between telehealth and telemedicine is that telemedicine refers specifically to online doctor visits. And telehealth includes the online doctor visits, but it also has health-related education services like diabetes management, nutrition courses, health-related training. It could be exercise, and so telehealth is a lot broader than that, and you'll see that a lot more with marketing and with industry software and applications that you might be interested in purchasing. So the telehealth and these technologies that are used for telehealth include audio, text messaging, video conferencing, and the video conferencing is a lot of it, like, of course, we're doing Zoom today, but the importance of recognizing when you get into these different ways or modes of delivering this is whether they're HIPAA compliant or not. And so if you are going into some kind of a counseling session or with a physician, you will more than likely use their technology because it has an extra level of security. The financial world is doing the same thing. If you are talking to a financial counselor and they want to do some kind of a video conference, it's through their organization because they're adding that extra level of security. So that's something to be concerned about as people are using these different technologies, is in making sure that they're safe and that they have been secured. So the telehealth has really made a positive impact for older adults that are living in rural communities. And this has been even more highlighted during the pandemic, that when people had the ability to, or ability is not the right word, were not able to go visit their physician as often as they want because they were concerned about that their health would be compromised. And so what telehealth has done is had provided them another means to connect with their physician without having to physically go to that location. And I saw this myself, is that my dad again needed to see a doctor every 3 months to be monitored. Well, where he's at is his assisted living facility, they had a lockdown and they did not want to have people coming and going, and they were concerned about that they would get COVID. And so that was the time when the doctors made the transition in a rural community, which is Ashland, Nebraska, saying yes, we are going to move to an online telehealth means of serving our patients. And so telehealth has really if you would look at it on a chart, it grew exponentially during the last 18 months. And it's amazingly that I think even the older adults who were not as used to using the technology have really valued this shift. But not only is the telehealth helping the older population, it's helping the caregivers. And myself as a caregiver, I have 3 parents that are over 80, and I have one in independent living, one in assisted living, and one in skilled care. So it's just really trying to being able to communicate and keep up with what all their needs are. It's been very helpful to have a health portal that I can have direct communication with the physician or the doctor and send them a note and ask them quick questions, or look on scheduling when their appointments are, or to look at their medication list, and so on. So the telehealth services, again, is very, very helpful for caregivers. It's important for you as you help people in this situation that the caregivers become more informed about this, and that they ask the physician to get a login of the person that they're caregiving for, and that they be more proactive on it. Because in my experience, it hasn't been something that they said, by the way, would you like to do this? Because I'm in this field, I've asked, how can I access this information? And so that would be one of my takeaways to you, is to as a caregiver, look more into how these health portals can help you. So, as I was preparing for this and also looking into the telehealth on some of these other initiatives, I found out that Medicaid and some other private insurers are now providing reimbursement for telehealth services. And I think that is really key to the adoption and the acceptance of using this. But I will say that it does vary from state to state. So you need to look into that. But this is huge then for being able to provide folks that are in rural communities or have mobility issues or health compromising concerns, that they can use the telehealth and still have it covered by their insurance. I wanted to highlight also that there's another couple of things in the evidence of investment into the telehealth and specifically into looking at assistive technology and aiding people to age more in place. And the first one, I don't know how many of you are familiar with the National Institute of Health, but that is one of the main organizations that funds a lot of our research and in this area. And this was a study that was started in 2016, and they were investing $7 million for a 4-year project, so it's a longitudinal project of more than 200 homes of people in rural and urban communities in the United States to see how technology could improve their quality of life. And so it will be very interesting to see all the results from this study. This was being led by a physician at Oregon, and so we'll find more about what's going on. But these areas of research that the government and the National Institute of Health are investing in, not only on they're going to expand on how the technology can help. And some of the areas that they're looking at is mental health, social interaction, isolation, nutrition, safety, rehabilitation. So there's a lot of areas that assistive technology can help, again, to help people stay closer to their loved ones and to their caregivers. So talking about disabilities, I'm a little bit generalizing here, but it seems that as people age, they probably have maybe a disability that also starts popping up. And so I thought these were some important facts for you to become aware of as we consider the future. Only 5 to 15% of the people who require prosthesis or orthosis or assistive health technology devices actually get them. Only 5 to 15% of them. In 2050, it's anticipated that there will be 2 billion people in need of assistive devices, with only 1 in 20 having access to them. So we really need to understand what kind of assistance do they need, how can we make it affordable. The technology our prices is coming down, it's being more easily accessible. So there's opportunities here for us to make a difference. I'm going to let you just take a glance at this. It's a little bit small on my screen for me to read everything here, but do look at this information here from the World Health Organization. So these are the most common types of assistive technology that you're probably most familiar with. And they help with mobility, they help with, there's a voice recognition, or if you're hard of hearing, the closed captioning on the programs on the televisions, modifying homes to include ramps and grab bars, and then also helping people with just everyday needs such as eating, toileting, dressing, and so on. So those are the ones that are more familiar, but as we move on, we're going to realize that there's other opportunities for innovations, especially to address the needs that 89% of the participants in the studies that were 75 or older would like to remain at their local community. And 80% of the participants in the study, 65 to 74 of them, would like to remain in their local community. So we know that there is a high demand and a high desire for people to remain in the community where they've grown up or where they're living currently today. So how do we do that? Well, we really need to look at what kind of innovations there are, and that helps the caregiver also feel comfortable that mom or dad or whoever it is can be an hour or 2 hours away and still not be as concerned, about their care. And so some examples are the wearable trackers such as Fitbits, Apple Watch, Garmin, and I bring up those because when you're looking at some of this and you're looking at health versus, I'm going to say, exercise and just taking care of your well-being, if it is used for a medical reason, you need to make sure that the device has been FDA approved and that it really has reliable data and it gives good information and it gets back to the physician and that it's correct. You can't be a plus or minus 5% off when you're dealing with medical things. It has to be very accurate. So that's something that, again, I would advise you, is that not only looking at some of this assistive technology, but looking at making sure that it has been fully tested and vetted. And that the physician is also endorsing them. Other types of new innovations is the ambient sensors or environmental sensors, and knowing you can test for if there's some kind of in the air like carbon dioxide. You can check into if there's something in as far as air quality, and like for example in Colorado with all their fires that they had in the mountains, there was alerts out often that people were not to leave their homes because it was a breathing hazard for especially those who had asthma. So we'll be able to also use some of these technologies to help know if there's any concerns on compromising health in the environment as well. So these are some common ones that you've probably seen. Just wanted to bring them up. Some other examples of assistive technologies that I think really empower people to stay at home and to take control and take care of their own personal health is we have, again, hearing what we said earlier about concerning about the safety of older adults, is video surveillance cameras. Also automated pill dispensers so that people remember that they should take their medicines, because if you don't take your medicine, it can be very challenging. I know from my dad's situation, he has diabetes, and when he is not taking care of himself on his diabetes, then his reasoning and his logic of decision making isn't as crisp as it should be. So that is a safety concern. Wearing a GPS tracking device, if some people are dealing with early dementia or people that are wandering, this also helps them know where they might be. A sensor mat with an alarm, knowing about mobility. Has someone gotten up during the day? As far as, are they getting up and getting dressed, or is there movement? So it's a reassurance again for caregivers. You have medical alert devices. You have the digital calendar. I have a family member that recently has had to go through rehabilitation and is in a skilled care to help them because they had a fall. And I talked to this person just the other night, and they said, "What day is it? I don't even know what day of the week it is," and so on. And I think we need to be sensitive that sometimes people lose track of that. And can they usually, an analog clock versus a digital clock, and that can be. So this is more it might seem obvious, but it's very helpful for people. A hydration reminder. Did you drink enough water? Again, I'm just using my personal experience, but I just had a different family member that got a cold, and their blood pressure was skyrocketing. And one of the first questions was, well, have you been drinking water? Well, I'm not really thirsty, or I'm not drinking enough. And so even simple things like hydration like that makes a lot of difference on somebody's health, and having them manage it so that, again, they can be independent. And so these are some very, very helpful assistive aids. Now, one of the barriers of people having these assistive technologies is the cost. And I had one of my research assistants do some investigating on the cost of different items that were mentioned, and they cost something, but they're not out of range. Especially if you for some adults. I mean, I realize if you're on a very limited income, some of these might be difficult, but they're not as expensive as they used to be. So we can look at that some of them being affordable enough that people can use them on it. And still help them remain in place, because it's less expensive to stay in place than it would be to move to an independent or then to assistive care and so on. So I mentioned that gerontechnology, and that we've been doing a lot of interdisciplinary research at UNO. And so I partnered with Dr. Julie Boron and her doctoral student Sarah Hubner, and we conducted a study on to specifically looking at what kind of technology are seniors using in their homes or older adults. And we started this study right at the beginning of COVID. And COVID was not, and the pandemic was not on our mind when we designed this study. And then you go a couple months forward and all of a sudden everything is shutting down. So we have an interesting study, but we also have, I would say, a very biased population. And the reason for that is that our study was a survey, and at this point it was an online survey. We had hoped to do a paper survey, we had hoped to go out and interview people, but we could not do that during the study. However, I think that there's some telling signs here, and there's some good patterns and some good trends that we can do as for takeaway. So these are all citizens of Nebraska. We had 114 respondents. We had quite a few of them, over 70%, were either had a 4-year degree or have a graduate degree, so a very highly educated group. 72% of them were retired. We had quite the income range was varied, and then over almost 60% of them were married, and 16% were widowed. But the important part here is that we can look at that if these are early adopters and they are in this age group, that they can also be trend makers and they can help us understand what will be better for everybody. So what we found here is that 99% of them had internet, 90% of them used a smartphone. So those things aren't totally surprising. 68% of them had used telehealth. And if you realize this is right at the front end of the pandemic, so they were accepting that technology. Now this is one chart. This isn't necessarily a telemedicine type of visit with the physician, but they were aware that they could get their health information online. Then you move on down to smart TV. What I thought was interesting is the grocery store services. If you recall again, in the middle of the pandemic, that's when all the online shopping and you could pick up your groceries. But again, if you're in a rural community, I don't know how it's going to serve you. So that is something that we need to think about. But at the bottom is you can see that smart home technology is not as pervasive. And so that might be something that we should be thinking about is how would is it not useful? Is it cost prohibitive? Or how could we make this more accessible? Because if safety is one of our key things, then we need to look into that. Once we knew what kind of technology or they had available, we wanted to also look at, like if they had internet and smartphone and so on, we wanted to say what was the purposes? What were some of the things that they used the technology for? Email is number one. And that doesn't surprise me. You see texting right up there as well. But the social contact, the interaction with family members, with friends, the technology really helps with someone feeling like if they're isolated. So we know that that's important. Another one that I think is interesting is the amount of, they use it for pictures. They read books electronically. Not as much in games, which is, I guess, just a kind of an interesting fact there. Now, there's 11% that don't use any of this technology. And so we need to dig into that and find out why. But it could be because of cost. It could be because they don't have the wherewithal as far as they don't feel comfortable using the technology. Maybe they just prefer to do other things. But so there is a group, a substantial group that did not use any of these. Well, if you do want to look at the costs, could that be prohibitive? Well, some of them probably are, but some of them, again, it depends on the trade-off. So this is some smart technology specifically for homes and the current costs. This is some smart technology as far as in-home and just for day-to-day living, and just having the technologies such as the mobile phones and the touchscreen tablets. Those can be fairly expensive. So again, maybe looking at ways that we can help offset some of those costs on that. And the smart home, looking at some smart home devices. One of them is like a smart stove, knowing when the stove should shut off. Smart lights that can be controlled. And again, if someone is gone for a certain period of time, maybe you want to control the lighting, or the lights automatically come on in a room when someone walks in there when it's dark so they don't stumble and fall. Smart thermostats, just to help, again, be more cost savings for the individual. But these are the things that we're seeing in the future of our smart homes. And then taking care of your health. Different types of smart health, the heart rate sensors, blood pressure sensors, therapeutic robots, which are robots that help you do, if you're doing rehabilitation, it helps someone do some of the exercises that they need to do. It could also be some kind, so the physical therapist can help with those. Or glucose monitoring for those with diabetes. I mentioned Polar here, and the reason why that I put Polar on this list is because it does have the gold standard and it has been approved by the FDA. And so again, when you're looking at what type of smart health that an individual might invest in, you need to also look at how has it been tested and the accuracy of the data. So some practical limitations to the adoption of this different usage of these assisted technologies is one is the security of it. And so you want to, when we're talking about security here is the security of the data. So what is happening to all the data of some of these smart devices that they capture from when an individual has? So if you have a Fitbit, what are they doing with the data that they've captured from that? Or if they're monitoring your heart rate or your blood pressure, who has that and who's seeing the trends on that? What are they seeing on your grocery buying habits? What are they seeing as far as your mobility, whether you're moving about in your house? So all of this data that is captured it needs to be secured. And so that's important to know. Another limiting factor, as we mentioned, is costs. For some people, these costs are affordable, but for some that are on very fixed incomes, it may be prohibited. The other area to look at is internet access and bandwidth, and I have a statistic on the next slide that I'll mention, but that still, it tends to be a problem that as you get more and more technology and you add video and you add audio and you add all this, the volume of it, then the internet has to grow as well so that it can, and access to the internet, and we say internet access and also the bandwidth of how fast can we move the data across, is going to be key. And lastly, do the individuals have the knowledge to use these technologies? And also to make sure that they're not vulnerable to cyber crimes because they don't know what they're giving out personal information that they shouldn't be. So these are important factors to think about as far as the adoption of these technologies. So in Nebraska, according to a 2021 survey conducted by ARC, 1/3 of the voters that are 50 and above say high-speed internet access is a problem in their community. That's a pretty startling statistic. The second is the same survey found that only 11% of rural homes had high-speed internet. So in order for telehealth and telemedicine to really take hold and to help our residents stay in their community, we still need to address this lack of internet access across our state. So in closing, if you're interested in finding out more about these studies, or if you're interested in looking at how assistive technology can help you in your organization, I'm happy to connect you with different resources at the University of Nebraska. I am leading with two other folks, a group called Transforming Wellness and Health Through Business, Informatics, and Technology. And we have researchers in all these different areas, and we're looking at how technology can, again, help improve health for our aging adults. We also have access to people in this, at the Center of the Biomedical Informatics Research and Innovation Center. And lastly, in my research lab where I work with students, and we look at how to improve the interaction of humans with computers, and specifically in technologies in healthcare. So with that, I will close, and please do send any questions you have and I am happy to have you reach out to me anytime you wish. So thank you very much.